Hi there, guys. It is your friendly neighborhood headbanger, Terry, and I hope that you guys are doing well. I am doing well. Thank you for asking, because I'm just going to assume you did, per usual. It is extraordinarily rainy outside and kind of bleh where I live, and it has been for the past couple of days. So I'm ready for that to be gone. And it's really funny. I asked my friends on Facebook if they would like to see a video about fibromyalgia, and they said yes, they would. And I think it's, a good video to do because there's a lot of mystery about it. And then, as life would have it, as my humorous life would have it, I wasn't able to make that video because of some things that fibromyalgia threw at me, like extreme fatigue and pain and just emotional issues, although in this day and time, I'm pretty sure that's not rare. Anyway, so now, finally, I have my face on, I'm dressed, jewelry, so I feel myself again, and I'm ready to make this video. So today's topic is fibromyalgia. If you've ever been curious about it, if you know someone that has it, or if you have it, it's, hopefully you will learn something. Probably not if you have it. If you have it, you probably already know. Feel free to leave comments down below about what you think, or if you've heard about anything different or new about this information, because I would like to hear that. So I'm going to put my old lady glasses on for most of this video because I have a lot of notes and I just don't want to guess at what they are. So, and my handwriting scary anyway, so I need all the help I can get. All right, so fibromyalgia. Fibromyalgia, what is it? It is now being called a pain disorder. It used to be called a lot of things: a muscular disorder, a soft tissue disorder. They're now calling it a pain disorder, and we'll get to why that's true here in a little bit when we get to causes. So the first thing we're going to talk about is symptoms. And the first symptom, the main symptom, is body-wide pain. Pain in the top half of your body, lower half of your body. That pain can take all kinds of forms. It can be a throbbing, aching pain. It can be a sharp, jabbing pain. It can be a fiery sort of my body is on fire kind of pain. So, there's a lot of different types of pain, but there's just pain. There's pain on the top half and the bottom half of your body. Over the course of like the last 3 months, almost daily is what the diagnostic is. But pain, there's a lot of pain. Extreme fatigue. And this is not the kind of fatigue where you say, I'm tired, I'm going to lay down. This is the kind of fatigue that says, I'm going to lay down before I fall down, and I am going to sleep, and you're not going to be able to wake me up. I might open my eyes and look at you and say a few words, but I'm not getting up. And this can last for a day, 2 days. It is just, it's not in a coma because you understand what people are saying to you, but you cannot get up. Or you might get up long enough to eat something or drink something, and then you will have to go right back to bed, and you may not even be able to do that. So, extreme, debilitating fatigue. However, on the other side of that is sleep disturbances. Some people with fibromyalgia find that they have issues with sleep. Got my coffee with me. So yeah, it's different for everybody, although almost everybody has this chronic, really bad, debilitating fatigue. All right, the next thing, intestinal issues. I'm not going to get into the details of that because it's gross. But yeah, intestinal issues like irritable bowel syndrome are very common in people that have fibromyalgia. Not exactly sure what that is about. They're not sure what the connection is, but it happens with a lot of people that have fibro. Restless legs. Now, a lot of chronic disorders have restless leg. And what that is I have it, so I'm going to try to explain what it feels like to me. To me, that feeling when you have a foot or a hand or whatever go to sleep, there's a feeling right before the tingling starts that, like, if you touch me, I'm going to scream. It's like your skin is just crawling. That is the feeling I have with restless legs, all up and down my legs. And it makes me want to scream. The only thing that makes it better is to get up and walk around. So a lot of people, or there is medication for it as well. So a lot of people with chronic disorders or autoimmune disorders or that kind of thing have restless leg syndrome. Migraines or tension headaches are very common with fibromyalgia. Not exactly sure what the connection is there, except for there is a lot of tenseness involved with fibromyalgia. If you hurt all the time, you would be tense. So fibromyalgia is also known to be weather related, like arthritis and other things like that. My fibro is worse when the weather is bad, when there are storm fronts moving in, when it's raining, that kind of thing. That's why it's been a little bit of an issue this past week, because it has rained off and on all week. So, okay, let's see. Depression and anxiety. Depression and anxiety goes along with fibro, and it's kind of a perpetual circle of fibro, depression, fibro. You'd be depressed and anxious too if you hurt all the time. So it's not necessarily that hard to figure out, but it does tend to go hand in hand with fibro, and makes sort of like I said, a perpetual circle of ickiness. Fibro comes in flares, and it's not that we feel horrible every day, all day. There are some times when we feel good, we have good days, we celebrate good days, we try to get things done on good days. It's just fantastic when we have a good day, and we try to literally seize the day, carpe diem. But when we have flares can last for days on end. We're tired, we're hurting, we probably have a headache, we are upset that we feel bad. It's just a flare is a very rough time for us, and we don't feel like being happy and sociable, and I generally just won't even talk on the phone if I'm having a flare, because I just can't. Okay, so another symptom or way of describing fibromyalgia that a lot of people with fibro use so that someone without fibro can understand it is like the worst case of the flu you've ever had. You ache all over, your skin is sore, you're completely and totally wrung out. Take away the stuffiness and the coughing, and that would be, for a lot of people, what a fibro flare feels like, a really bad case of the flu. Okay, the profile of who gets fibro. Now understand, this is not a definite profile of who gets fibro. There are outliers in every statistic, so I'm not saying these are the only people that get fibro. I'm saying that these are the people in studies that fibro seems to affect more. So, often it is females from age 30 to 55. And it's interesting that is also the time when females are getting married, having families, working, that sort of thing. They're very busy. They're doing a lot. They're just going on high speed. I certainly know I was. So 30 to 55 is the normal age of an onset. It is often comorbid with people who have autoimmune disorders. So disorders such as lupus, rheumatoid arthritis, Hashimoto's disease, MS, anything like that. It's often comorbid with osteoarthritis, which is my case. I have osteoarthritis and a pretty progressive, I've been dealing with it now for about 10 years. So it started early and it's pretty progressive. And so I have fibro along with that. Interesting enough though, and I think this is true of most people that have arthritis and fibro, I can tell the difference. It's completely different. Fibro is not in my joints, and arthritis is absolutely in my joints. That's where the pain is. So I can always tell the difference. Okay, it mostly affects adults, but it can affect children, and when it does affect children, it's usually teenage girls. And I can actually remember having times when I was in high school when my shins would hurt to the very bone, and I would sleep all day. Not because I was lazy, but just because I could not get up. So I think that might have been beginning even in my teenage years, and that is certainly the case here. Okay, causes. The causes of fibromyalgia have been for debate for years. a lot of people in the beginning thought fibromyalgia wasn't even a thing, that it was something else that was being misdiagnosed or whatever. But we do have some causes now that scientists are beginning to feel pretty good about. The first one is genetics. Fibro does tend to run in families. My grandmother, I think a lot of people thought that she was lazy and that she was just, she did have a lot of other issues, but she was in bed a lot. She was tired a lot. And she did have the type of pain. She would ask my dad to rub the shins of her legs to try to make them feel better because she just had a really deep pain there. And a lot of that sounds kind of like fibro. So, it does tend to run in families, and she is the one family member I can think of that kind of fits the criteria. Also, certain genes may be triggered by stress or illness. And that is, we'll get to that in a minute, because that is one of the things that can trigger fibro, is an illness. All right. They now think that fibro is basically a central nervous system disorder. And what they think is that the pain signals from the nerves are amplified by the brain. The brain is turned up to, the pain receptor, the pain part of the brain is turned up to, as Spinal Tap would say, 11. And so we perceive pain in a completely different way than other people do. You can poke me in the arm, and it feels like you put a thumb and mashed it into a bruise, and it will last for a good 15 minutes at that level of pain. That should not be. That should not be a thing. I have points on my body, they're called tender points in fibromyalgia world. I have points on my body that if you press them, it will give that sort of pain, and it will last even longer, and I will probably cry out. That doesn't happen with other people when you press those points on their body. So our pain reception is just really ramped up. We feel pain much more than other people do. And that is why when we hurt in our body, when we have aches in our body, it is so debilitating, because our pain is just, like I said, it's turned up to 11. And they are beginning to try to make strides into why that is so in the brain. What is it about the message from the nerve to the brain that makes it so amplified? There is something called substance P in the brain that has to do with pain reception, and some tests have shown that some people have more of that than others, but I don't think that's a definite thing that they're saying right now, that substance P is the issue. But it's a good place for research. All right. Let's see. Also, fibromyalgia can be brought on by some sort of trauma. It could be an emotional trauma. It could be a physical trauma. It could be and the physical trauma could be a severe illness. It could be something long-time chronic. Like, for example, I had an eating disorder for, years and years and years, decades, if you've seen my eating disorder video. And with that eating disorder, which was bulimia, I traumatized my body every day by throwing up, 5 and 7 times a day. And so that was very traumatic for my body. That could have easily, triggered something. PTSD. PTSD can trigger fibromyalgia. It has a lot of things in common with fibromyalgia. Depression, pain, fatigue. So one could, PTSD can trigger the onset of fibromyalgia. Let's see. Certain types of infection, like mononucleosis or pneumonia or something like that. There's literally a cat fight going on beside me between my cat Sophie and my big black cat Casey. So if you heard, that was that. And the last thing that can trigger fibromyalgia is depression. And remember, we talked about that was a circle. I think I called it a circle of ickiness. It's really just a circle of pain. Depression causing fibromyalgia, fibromyalgia causing depression. So it's, like I said, it's a little bit of a circle. Now, diagnosis. Once upon a time, doctors used to, and this is actually how I was diagnosed, used to diagnose fibromyalgia by the tender points that I told you about. We have tender points on our body that if you press them, we will freak out. And used to, diagnosis was that you had to have a certain number of tender points. I want to say like 13 out of 18 or something like that. On both the top of the body and the bottom of the body, you had to have those tender points. You had to have enough of those to have a diagnosis. They have gotten away from that because not everybody has tender points in the same places, and sometimes people have tender points and then they don't, and so they found that that was not a very good way to diagnose fibromyalgia. So now they're saying things like, you must have had your symptoms of fibromyalgia, the main ones being widespread pain and fatigue, for the past 3 months for the majority of that time. So it has to be something that's been going on for a while before they will diagnose it. They will also try to find and rule out any other medical condition that could be causing this. So if they come to the conclusion that there's another medical condition that could be doing this, like for example, there's a condition called polymyalgia, which is similar to fibromyalgia, but does go away, can be treated usually with steroids, and eventually does go away. And I actually know someone who had polymyalgia, and it was very rough for them, but they eventually did get better. So, let's see. And also, they have now developed a test for symptoms. And one of them is the widespread pain, where there are 19 indicators that they talk about, and I believe that you need to have like 12 or 13 of those for them to have a diagnosis. And there's also a symptom severity scale, and that has literally 3 items on it: fatigue, waking up still tired or unrefreshed, and problems with thinking, which people that have fibro call fibro fog. And the problems with thinking involve not being able to remember things, not being able to comprehend a lot of information when it's given to you. People with TBIs, traumatic brain injuries, call it flooding. There's too much information and you can't sort through it and put what needs to be put first. First you need help organizing it. So that can too be a part of fibro fog. I thankfully do not suffer from fibro fog terribly bad. If I do, it's memory. I forget to do things. People tell me things that are kind of important, and I forget to do them. I just space it. So these 3 symptoms on the symptom severity scale are rated from 0 to 4. And 7 is generally the lowest number that they'll take for, the severity of it. Fatigue, I would probably say I rate between a 3 and a 4. Waking up still tired is a 4. I could go back to sleep probably every morning of my life. And thinking problems, I would probably rate about a 3 in the memory department. I need things to remind me now to do things. And, part of that, I'm sure, is just getting older. I'm not exactly a spring chicken anymore, but part of it is I have noticed as fibro goes on, I've noticed even back in the day, I would forget things that needed to be remembered. Now, that's an important thing to talk about where fibro is concerned. It is lifelong. It's not going to go away. It's not curable. You can manage it, which is what we're getting ready to talk about next, but it's not going to go away. If you are friends with someone who has fibro, you're dating someone who has fibro, you're engaged to someone who has fibro, or you're married to someone who has fibro, it's not going away. It is a lifelong thing. My husband is a saint for putting up with my fibro, because it will cause me to cry, it will cause me to have emotional outbursts, it will cause me to sleep for days, and it will cause me to say, I hurt, I'm in pain, and he can't do anything about it, and that makes him a little crazy. So fibro is lifelong, and if you know someone who has fibro, that's a lifelong investment. So just to let you know, it's not going away. It's not curable. Can you treat it? Yes, you can. Wow, I sound like Bob the Builder, don't I? Okay, so for treatment, one of the first things that you could do is reduce stress. Stress is a big deal in fibro. It exacerbates it, and it can even cause it. So you need to get rid of stress, and the ways that you can do that are you could do medication, not medication, I'm sorry. Well, yeah, you could. You can do anxiety medication. You can do meditation, which is the word I was actually going to say, biofeedback. You can do just anything that can help you de-stress. And you can actually say to your family or your friends, when I say no or when I can't do this, you need to let me, you need to accept that, because I can't be stressing over whether or not it's going to upset you. Just be cool with it, because if I think that you are upset that I can't do or go somewhere that's going to stress me out, it just makes it worse. Another thing that will help is to treat the depression. You may have had depression before fibro, or you may have developed depression after fibro, because it is depressing to hurt all the time and to feel bad when you can't do things or can't meet responsibilities. So treat depression, and there are a lot of ways you can do that. You can do talk therapy, medication, again, meditation. There are ways that you can do that. Try to improve your sleep. Try to do that by having a sleep plan. You don't drink caffeine after a certain time, go to bed at the same time every night. If possible, you might need medication help with that too. Sometimes I do. Sometimes my circadian rhythm gets so screwed up between my major depressive disorder and my fibro that I actually need to take something for a few weeks, usually, to get it turned back around. Let's see. Usually the doctors that are going to treat you are going to be your general practitioner, your GP, a rheumatologist, because even though fibromyalgia is not a joint disorder or an infectious disorder like rheumatoid, a rheumatologist, they have kind of sort of taken the lead in trying to help, deal with this. Since it is pain in arms and legs, they have actually sort of been the go-to for fibromyalgia. And also a psychiatrist. If you're having issues that you need some sort of medication to help with depression and anxiety, you would be seeing a psychiatrist for that. The medications that are used for fibromyalgia are really interesting, because the top two, which are gabapentin and, Lyrica, are actually, gabapentin especially, is an anti-seizure disorder. Or not an anti-seizure disorder, an anti-seizure medication. Sorry. I'm getting loopy here in the last little bit of this. But I actually use gabapentin, which is the generic for Neurontin, and I find that it helps a lot with pain level, because now that we've realized that fibromyalgia may very well be a central nervous disorder, it makes sense now that Neurontin, which works with nerves, would, be a thing that would be useful in treating it. So I take Neurontin, and it does help me with sleep issues and with nerve pain and my fibromyalgia pain. Other medications are antidepressants, obviously, to help with the depression problem, and sleep aids like melatonin for the natural route, or Lunesta for the medication route. I have said that I will take a sleep order sometime, or a sleep medication sometime, and Lunesta is the one that I take for about 2 to 4 weeks to get my circadian rhythm turned back around. I don't take it all the time, and that's good, because I don't want to be dependent on it. Non-medical treatments. Cognitive behavioral therapy, talking to yourself, telling yourself it's not your fault, telling yourself that this is what you can do today, telling yourself that people don't dislike you because you tell them, that you can't do something. Cognitive behavioral therapy is a really, really good thing for this type of chronic disorder, so that you don't develop feelings of guilt and just feeling bad about yourself. Relaxation techniques, that's a non-medical one. We've talked about that before. Meditation, deep breathing exercises, guided visualizations, tons of videos on YouTube that can help you do a guided visualization to de-stress or to go to sleep. There are even relaxation videos for pain. So, you might find something there that helps you. Exercise, getting up and moving. If you have comorbid rheumatoid arthritis or osteoarthritis, you're going to want to find something that is non-weight bearing. Walking, swimming, those kind of things are really good for that. I love swimming, so unfortunately, we don't have a pool, but there is a pool nearby, so that's okay. One of the things I want to say about that, though, is if you don't have fibromyalgia and you don't want to be throat punched by someone who has fibromyalgia, do not say to them that you just need to get up and move and go, and you just need to run and you need to do all these things. Because A, that person may not feel for a week, like even getting out of bed, much less getting up and going and running somewhere. Do not make them feel guilty if they cannot engage in the kind of exercise that you can. And I'm going to go over 25 minutes on this video, which I try not to do because I feel like this is important, and hopefully you've stuck with me for this long. Don't make them feel guilty because they can't do that or don't want to do that. Just be thankful you have a healthy body that you can do that, because people with fibromyalgia don't. And we really have to sometimes force ourselves to move and to do any kind of exercise at all. So yeah, just don't be a jerk and tell them that that would be the thing that would fix them, because it might help, but it's not going to fix them. We haven't found a thing that fixes it yet. And last but not least, there are support groups. I belong to a group on Facebook called Bent Not Broken, and it's for any type of chronic disorder, autoimmune disorders, fibromyalgia, just anything like that. And it is really good to talk to other people who have that type of problem or disorder, because they can often relate to some of the things that upset and frustrate you, like some of the things other people say, or some of the things that they're upset with about their own body. Sometimes they share information like, hey, you know, when I do this, I feel better. Or, hey, my doctor said this, you might want to ask your doctor about that. But a lot of times it's just a place to get your feelings out, just so that you can take out the mental trash. I firmly believe that you need to talk about things, because if you don't, they stay in your head and they just rotate and get bigger. They're like a cotton candy thing. If you've seen someone make cotton candy, it starts out really small and just gets bigger and bigger and bigger. That's kind of the way bad thoughts are in your brain about something. They just get larger and larger as they go round and round. So get rid of that. Get rid of that. Journal it. Talk about it. Do something to get rid of it. I hope that this was informing for you guys. I'm sorry I sort of tripped over my tongue a few times. That in and of itself is a fibro thing. I can't put my words together. But I appreciate you staying this long, because it did go over a little bit. I hope you guys are safe. I hope you guys are well. I hope you guys are socially distancing and wearing your mask. And I just hope that this thing gets a lot better very soon. Love you guys. Take care of yourselves. Bye-bye.